Question 22b from the half-yearly exam asks students to, using a case study you have examined, demonstrate how health promotion based on the Ottawa Charter promotes social justice. So you have to use a case study, as the question says here. Let's just go and have a look at some of the syllabus dot points that we've got here already. So from our syllabus, we know that health promotion based on the 5 action areas of the Ottawa Charter. We move further down, how health promotion based on the Ottawa Charter promotes social justice. That's exactly where our question has come from. If we go and look and see what we actually gave you for the exam, you'll notice how health promotion based on the 5 action areas of the Ottawa Charter, and we've taken out the others again. How health promotion based on the Ottawa Charter promotes social justice. So again, we've given you the specific question that part of the syllabus that you needed. We've taken out all the others. Students only need to do this one area here. And they need to make it, as the question asks, using a case study. Now, a case study that we used in class, which we gave all the students a copy of, was the one on the New South Wales Refugee Health Service. This one was the best one to do for students because, as we explained to both classes, was that it sets it out for you. Demonstrate social justice. Demonstrating social justice through the Ottawa Charter. All students were given a copy of this. You had to have an understanding of this one. The better students, those that were able to achieve a very good mark for this question, were able to use this as a case study because it goes through and it shows how each area of the Ottawa Charter relates to the refugees and it promotes social justice through examples of developing personal skills in the different action areas. That's what the question was asking you to do. If we go back to the question using a case study, so the refugee case study, demonstrate how health promotion based on the Ottawa Charter promotes social justice. Need to include a case study. So the refugee was probably the best one to do. Looking at the Ottawa Charter, so the 5 action areas of the Ottawa Charter have to relate to the case study and how do they promote social justice. Not what is the Ottawa Charter, the 5 areas, and give an example. Ottawa Charter, the 5 areas, how it relates to this to promote social justice. That's what the question was asking you to do. If we have a look here, if we go through this answer, because this is a very, very good answer. Case study examined that promotes social justice based on the Ottawa Charter is the Refugee Health Service. Straight away, the student has identified the case study that they're going to be using for their answer. And then because it's called Refugee Health Service, the RHS, known as the Refugee Health Service, creates supportive environments by working with government and non-government agencies to identify the needs of newly arrived refugees. This supports newly arrived refugees in regards to provision of housing, which improves equity and creates supportive environments. Let's go and have a look at our case study. Create supportive environments. The Refugee Health Service works with government and non-government agencies, including the Refugee Council of Australia, to identify the settlement needs, talking about housing, of newly arrived refugees. That's as clear as it can be. The example is as specific as the sheet that the student would have been given. The Refugee Health Services builds healthy public policy by working with New South Wales to develop and advocate policies which better suit the needs of refugees. Let's go and have a look at the case study again. I think I've gone, building up the top. Building healthy public policy. New South Wales Refugee Health Service aims to protect and promote the health of refugees and people of similar refugee-like backgrounds living in New South Wales. Works with New South Wales to develop and advocate for public policies that better meet the health needs of the refugee community. That's how they're demonstrating social justice principles. We gave it to you. We pretty much gave you the answers in class. This student has been able to do that. So each area of the Ottawa Charter, the Refugee Health Service develops personal skills by providing refugees with pamphlets regarding healthy eating and also provide education on healthy eating through trained community leaders in many languages. This provides refugees with information and empowers them to attain knowledge and develop skills. Let's have a look. On arrival in Australia, refugees are introduced to new food and preparation methods and do not necessarily have the knowledge to make healthy choices about what to feed themselves. The RHS Nutrition Project implements a number of complementary initiatives, including use of dissemination of pamphlets titled Healthy Living and Eating in Australia to selected refugee communities. They also conduct education sessions on healthy eating in a range of languages. Exactly what our answer just showed us and just told us all about. So it's straight from the sheet. It's easy. It's a very, very good answer. Refugee Health Services strengthens community action by creating forums which allow disadvantaged groups to contribute to discussions on health issues and problems. This enables the disadvantaged groups to speak out about inequality and unavailability of access to resources and be heard by the wider community. Strengthen community action. The Forum of Health and Settlement Needs of Older Refugees is one of the several initiatives which the New South Wales Refugee Health Service initiated. The forum aimed to develop a plan of action across agencies to promote the health of older refugees by raising awareness of refugee ageing issues, influencing aged care policies and creating a bridge between them. Again, not as exact, but same sort of information has been presented here that was in the answer because it's come from the one specific sheet. And as we go further down, the last one, Refugee Health Services rearrange health services by allowing newly arrived refugees to access healthcare facilities, services and doctors. This provides refugees with the vital first contact needed to survive in a new country, improving equity and access through available health services. The Refugee Health Service runs specifically designed clinics in Western and Southwestern Sydney to provide recently arrived refugees initial contact with the healthcare system, exactly as it stated in the answer. So the 5 areas of the Ottawa Charter have been included. The case study being the national refugees, which is the easiest one to do because of the way in which, as you can see, it's been set out. Demonstrating social justice through the Ottawa Charter, Refugee Health Service, and it promotes social justice. The area has been underlined, probably a little bit too much underlining for me, so we can fix that up. Phone me for next time. But overall, it's exactly as the question would have liked it to do. Some other students use things such as the tobacco and the Beyond Blue. Look, they're still case studies, and I was happy for students to use them. But I think they really struggled to demonstrate how they promoted social justice. That was the difference between doing the other 2 case studies, which were used in the Ottawa Charter in action, as opposed to looking at the refugee one, which was specific on social justice principles. So students need to be aware of the different case studies, and we haven't explained why the refugee would be better to use for different ones relating to social justice. And the headings are there as well. It comes down to preparation. Again, the link between the social justice and the Ottawa Charter relating to the case study, had to be evident in your answer. For 10 marks, for 6 marks, I should say, a decent level of content, some underlining. Overall, wasn't a bad answer. I just think some students who didn't use the refugee health service, they struggled to really get their point about, as the question asks, how it promotes social justice through their answer. It wasn't just telling me about the Ottawa Charter, then telling me that develop personal skills is putting education in schools. That's not promoting social justice. That's just telling me what the Ottawa Charter is. That's the Ottawa Charter in action. So that was the difference between a 6 out of 6 and a 3 or a 2 out of 6 based on what sort of response and how they related their answer to social justice.